name is NURSYAFIQA Nadia. I will presenting wrist bandage. Now I will present how wrist injury happens. Wrist is frequently injured and there are a variety of injuries that can occur, including a sprained wrist fracture, ligament tear, and so on. A sprained wrist is most commonly caused by a fall or a forceful twisting motion of the wrist. Because many wrist injuries have similar symptoms, it can be difficult to determine the severity of your injury. A sprained wrist suggests a ligament has been stretched or torn. So, most common symptoms of sprained wrists are swelling, pain when wrists are moving, and bruising. The equipment for wrist bandage is a roller bandage.
Hi, my name is NURSYAFIQA. I will show you how to bandage an injured wrist. So here we have someone with an injured wrist. What we are going to do is start around the wrist, making sure we smooth out any creases, and we are going to travel up and around the thumb and back around. We call it as figure 8. So what we are gonna do next, we will continue wrap the injured wrist until the bandage finish. Lastly, we will pin the bandage with the safety pin. So here the result of the wrist bandage. The thing that we always have to do is to make sure the fingers are not going numb. If it numb, it means the bandage are too tight. That's all. Thank you.
A very good morning. My name is SITI NURDIANA BINTI Ali, and I will continue with the elbow injuries. How elbow injuries happen and what we need to do and how to bandage it. So first thing first, we need to understand our elbow anatomy. Our elbow has a visible joints where humerus and ulnar that connected by an tensor, common extensor tendon, and also the help from the lateral epicondyle. As you can see here, the diagram, our elbow. So this is our elbow anatomy. Our elbow anatomy has several of elements that connected together that allow us to move freely and do our routines. And if we didn't be careful and encounter with the dangerous and harmful situation, it can lead to the various kind of injuries. Like the first one, we will get the dislocation, fracture, tear, or in the next case, we can get the tennis elbow, which is in the specific terms, lateral epicondylitis, or it means that we overuse our muscle. The next one is a medical epicondylitis, which is a colfoid elbow, which is we repeated stress on the inner side, which is we do the activity repeatedly until it stresses our muscles. So how we can know this is the elbow injuries? So there are several symptoms that can look into. Like the first one, you start to notice that your elbow swelling, you feel the pain sensation when you move your elbow, or your elbow will be difficult to move, and maybe your elbow become locked, like you feel the lock sensation or grating sounds. And when you touch your elbow, it feels warm, and you also notice that your elbow discoloration. But in the light case, which is not worst case, you only encounter with the swelling, pain sensation, difficult to move, and lock sensation. But in the worst case, there will be a grating sounds, feel warm when you touch your elbow, discoloration, because it is related with the infection and also other case like tear. So when you encounter with the elbow injury situation, what should you do? First thing first, you need to search for the suitable equipment, the correct equipment to treat the elbow injuries. So when we do our activities, your elbow might be scratched or tear skin at the outside of your elbow. So what kind of equipment that you need? Maybe you need the adhesive tape, adhesive plaster, yellow solution, gauze, and more that can help you to cover the wound. But for the inner side case, for the elbow injuries, you need to find and use the elastic bandage, for an example, elbow gear, and also if you encounter with the worst case like fracture, tear, or you can't move your elbow, you might need the triangular claw to support your elbow. So moving on to the treatment. So how to treat your elbow injuries or other people elbow injuries when encountered with this situation. So first you need to grab the equipment that can help you treat the elbow injuries that we have been talked about before. So in this case, this is the light case, which is you can use the bandage for your light and not worse injuries, feel pain. So first thing first, you need the elastic bandage. So you need to start wrapping the bandage far from the injury location, like in the middle or the upper or lower part of arm. It is because we don't want to put a lot of pressure on the pain part. Okay, it is because the bandage we want to support the injury part to ensure the pain can be bear by the patient. Okay. Second, if you start wrapping at the upper part of the arm, then you need to wrap the arm by bringing it to the lower part of arm. And the bandage should be wrapped snugly by wrapping around the elbow closely, like in the picture side. And you need to repeat the wrapping from upper part, then go down to the lower part until you have at least 3-inch left. And then the bandage also should finish with the secure pin in the middle of the upper or lower part of your arm, which is far from the injury part, because we don't want to put too much pressure on the pain because it will give uncomfort to the patient or yourself. So last but not least, try to move the patient arm gently and pinch the fingernails a little bit to ensure the bandage not too tight and does not disturb the blood circulation. At least as fast as 3 seconds. If more than 3 seconds, you need to redo the bandage. So,
Hi, my name is Nuri Izzah, and I'm gonna to present about my injury, which is the head injury. Head injury usually happen when the person fall down onto sharp things and cut off their forehead or their scalp. Okay. Sometimes the wound can be deeper and need immediate treatment, which is the cut can be deeper and can cause the bleeding and concussion, and they need immediate treatment to stop the bleeding. So I choose the forehead injury, which is located in our between the eyes and then the scalp here, and the injury usually have in this area. And then for the scalp injury, usually it has on the top of our head. So this type of injury, which is for head injury, usually happen where the kids always bump into the thing and then hit their head. Sometimes they can be cut deeper, and we need to stop the bleeding immediately so we can took them go to the clinic and get a further treatment. Okay. So let's go move on to the next treatment, how to treat the forehead injury.
Okay, here are two things that we need for forehead bandage. The first one, the cotton for cover up the wound, and then the roller bandage to secure the wound. First, we need to clean up the wound and cover it with the cotton to stop the bleeding. Then take the bandage and rub it down the head so we can secure the injury on the forehead. Make sure the bandage are not too tight and the patient comfortable with the current bandage. Lastly, secure the bandage with the pin so it doesn't fall out. Tidy up the bandage a little bit and ask if the patient comfortable with the current bandage. That's all from me. Thank you.
Hi, Assalamualaikum. My name is ZAINAB. So I will be explaining regarding shoulder injury. So firstly, on how shoulder injury happen. So first is by shoulder sprain. So shoulder sprain is a separated shoulder or a acromioclavicular joint injury that is sometimes referred to as a shoulder sprain. Shoulder sprain include trauma directly to the shoulder from a car accident. Other than that, shoulder strain is stretching or tearing of a muscle or tendon in the shoulder. So it can happen when the shoulder remains in one position for a long period of time, such as when carrying a heavy backpack over a shoulder or having a poor posture while typing. So the shoulder tear is usually an injury to the soft tissue that give the joint range of motion and stability. So a tear can occur in the tendons, the muscles, or the labrum, a rim or of fibrous tissue that lines the glenoid. So I will be explaining on how to do a treatment on the injured shoulder. So you will need a triangular bandage. So first, you need to ask the patient to hold their arm with their other hand, and then be sure to slide the bandage underneath the injured arm, and then be sure the point of the triangle is underneath the elbow. Then around the back of the neck, bring the top end of the bandage, and to meet the top of the bandage at the shoulder of the injured side, fold the lower end of the bandage up over the forearm. And then when the two ends of the bandage should be tied together in a reef knot. Then you need to tuck in the ends just above the collarbones. And to ensure full and proper support, you need to adjust the sling of the injured arm. Then twist and tuck in the fabric of the edge of the bandage by the elbow to properly secure it. So lastly, you need to make sure that the patient is fine and check the sling whether it is uncomfortable or too tight for the patient. Okay, so right now we're going to do a shoulder bandage using triangular bandage. Can you hold this arm for me? we're going to do a reef knot. So first, and then tuck in the excess cloth. Turn around. So this is the excess cloth. You twist it and tuck it in here. So actually you can use a safety pin, but if you don't have safety pin, you can just use this like this. Okay. So if you don't have safety pin, you can just twist it and tuck it in. Make sure that it is neat, but it is better to use safety pin so that it is more secure. Okay. Adjust the sling.
Hi, I am NURSYAFIQA. So now I'm going to present my part, which I choose is ankle injury. Ankle injury is an involvement of ligament in the ankle which can cause an ankle sprain and also swelling. Ankle is composed with few bones as fibula and tibia, which connecting your ankle and calf, and also tarsal and metatarsal in the foot. The three ligaments that involve in ankle sprain is anterior tibiofibular ligament, calcaneofibular ligament, and also torn anterior talofibular ligaments. The thing that can cause an ankle injury is during a sport activity and also walking and running on uneven surface, which also during your walking and running you may step in a hole, and this will cause your ankle to injure. The symptom of ankle injury is swelling, bruising, discoloration, difficulty to move, and also soreness. As you can see, bruising is discoloration. As a picture, you can see the ankle is become blue and also purple. So now, let's see how to treat an ankle injury with a bandage. The treatment: first one, make sure to use a roll of elastic bandage and start to roll the bandage around the foot and end the bandage at the side of foot. Slowly move the bandage around the ankle and move to roll the foot back. The third one is move the bandage around ankle some more and continue to bandage around the ankle and foot, then end the bandage at the lower calf and on top of ankle. Last one is make sure the wrap cover the entire foot and at the ankle. Clip the bandage with clip fastening, or you also may use the self-adhesive tape to secure the wrap of the bandage. So for me, thank you.